building a resilient health sector in the country for Liberians to have access to quality and affordable health care is challenged by yet another wave of protests and ultimatums, this time from the Liberia Medical and Dental Association, LMDA, in conjunction with the Liberia Medical and Dental Council, LMDC. The current threat of the doctors and dentists' ultimatum over their pending strike to lay down their tools is life-threatening, and their angers would definitely be felt. The overall unhappiness of the entire medical staff, including nurses, occupational therapists, porters, paramedics and healthcare assistants, has a nosedive effect on the health sector, which has struggled to rebound since the Ebola epidemic in 2014. On Friday, May 11, the LMDA and LMDC announced their 72-hour ultimatum, which began on Thursday, May 10, over the arrears of 3 months' incentives for 40 intern doctors and the reinstatement of 46 doctors who were deleted from the payroll and classified as ghosts. Addressing a news conference, the president of LMDA, Dr. Louise Nkpado, and the chairlady of LMDC, Dr. Linda Birch, expressed frustration over the removal of the licensed doctors, who have completed internship and are currently in the various counties doing their intensive emergency obstetric care, MOC. In a special statement read by the Secretary General of LMDA, Dr. Jonathan Hart, he said more than 100 medical doctors are yet to be placed on payroll and about 40 interns have not been paid their incentives for 3 months. What is even more disgusting and annoying, was that while appealing to the doctors to hold on to faith and hope as we negotiate a suitable and peaceful solution, in the same month of March 2018, the Ministry of Health removed a significant number of doctors from both incentive, payroll and labeled them as ghosts, but they were actively working without their rightfully due salary, incentives, Dr. Hart said. These actions of the government over the years, and recent actions, led to a resolution passed and adopted by the LMDA in our second bi-monthly meeting, held on the 28th day of April, 2018 in Ganta, Nimba County, calling on the Minister of Health to make immediate payment of arrears and reinstate those doctors removed from the incentive and salary within 72 hours as of Thursday, May 10, and regularize the incentive and salary structure of those doctors affected, no later than May 30. The LMDA urged Liberians and foreigners to brace themselves for the consequences of their go slow, beginning Sunday, May 13. Furthermore, the LMDA has also urged President George M. Weah on the implementation of the negotiated salary scheme of medical doctors and dentists, as per the November 14, 2016 demands and upgrading of all health facilities. The medical doctors and dentists emphasize that promises made to them by then-President Ellen Johnson Sirleaf were not met, and they are therefore urging President Weah to effect those promises as of July 1, 2018. They want government fully implement the resolution of the doctors for the improvement of their lives. Names of some of the licensed doctors removed from the payroll in March 2018. In the resolution, the doctors called for improved salaries, insurance and other benefits developed through a policy document and implementation of the salary scheme agreed between the government and the doctors. The doctors also want graduates who are on intern programs to receive their full incentives, the upgrading of all health facilities to the minimum standard contained within the essential package of health services. The doctors threatened serious consequences in case of any delay and breach of the implementation of the resolution to include a full boycott of all health facilities in July of this year. They are therefore calling on the public to prepare for a major health crisis if the government fails to meet their demand, indicating that they are tired suffering of low income despite their services to the nation. Mr. Sorber George, media officer at the Ministry of Health, acknowledged the issue of arrears on salaries and incentives, but expressed surprise at the LMDA statement. "We are shocked that the doctors will go public with their concerns," George to the Daily Observer in a telephone interview on Saturday, May 12. 3 days ago we met with the doctors over the issue of their salaries. We promised them that we would submit the payroll to the Ministry of Finance, which we did immediately following that meeting. It may be recalled that, in November 2016, doctors from across Liberia gave a 72-hour ultimatum in demand for their over 3 months' salary arrears. Their arrears were fully paid but, according to them, government fails to improve the public health facilities and improve their salaries. Hart continued, "If the government does not make payment of our salaries, we will take a strike action. We will gather at the Ministry of Foreign Affairs where the President works." According to George, for the months of March and April 2018, the intern doctors will be paid according to their status as intern doctors. For the month of May, their salaries will be upgraded to that of licensed doctors, he said. The Ministry of Finance is currently processing their salaries, George said. As of May 2018, they will be paid as licensed doctors, compared to intern doctors as they were before. Sorbert George insists that the ministry did not intentionally take doctors off payroll. The ministry instructed the Internal Audit Agency, IAA, to conduct an audit, and it was the audit that recorded some doctors and other healthcare personnel as ghosts. "We've begun verifying the names and asked people who were recorded as ghosts to come forward," Sorbert George to the Daily Observer in a telephone interview. Shortage of doctors in Liberia. The Liberia Medical and Dental Council said as of September 2017, there were 339 medical doctors responsible for the 4.5 million population, making the doctor per patient ratio 1:15,000. The field of specialty is limited. The LMDC statistics showed that there are currently 250 general practitioners, 21 public health specialists, 16 pediatricians, 12 obstetrician-gynecologists, 9 internal medicine specialists, 6 dentists, 6 family medicine specialists, 6 ophthalmologists, 4 psychiatrists, 2 orthopedics, 2 emergency medicine specialists, and 1 of each specialist in dermatology, ENT, ear, nose and throat, infectious disease, neurosurgery, occupational health and pathology. Norwu Howard, Deputy Minister for Administration, Ministry of Health, photo, Derek Moore. The figures show that the number of doctors is increasing, from the 278 reported last year, but with the constraints of motivating doctors beginning with their payment during internship and subsequently placed on government's payroll is hiccup that would drive many from the medical profession. George said Norwu Howard, the Health Ministry's Deputy Minister for Administration, led a nationwide performance assessment of the health sector to identify gaps in order to develop solutions. The representatives sent by the ministry to the counties could not reach certain areas because they complained of bad roads, George explained. Therefore, those employees in the areas that could not be reached, the representatives recorded them as ghosts. As a case in point, George told of a human resources officer at the government hospital in Rivers County who the health ministry team met on their excursion, dressed all in black. When asked if he was mourning, the human resources officer answered, "Yes, I am mourning my ghost that was taken off the government payroll."